Well, hello everyone. Welcome to our fourth session in the SEED series. And today it's a great pleasure to introduce to you Robbie Tyson. The topic for today's session is, where do I focus? Healthy eating or physical activity? And that's a question that many people with diabetes confront when they first get diagnosed with it. But it's also, it's trying to create that balance. So hopefully this will be a very informative session for you. So our guest today is Robbie Tyson. Robbie is a credentialed diabetes educator who is also an accredited practicing dietitian. Robbie has tertiary qualification and experience as an exercise scientist and teacher. Robbie has over 20 years experience in the health and education sectors, specifically in the prevention and management of chronic disease. Robbie has worked extensively in remote and clinical remote communities of Cape York. That would have been fascinating. And delivering community and clinical dietetic services for Aboriginal communities controlled health organisations. During this time, Robbie has developed a strong belief in a person-centred, evidence-based approach to healthcare that assesses the individual readiness for change, importance and confidence to support sustainable life change. Man after my own heart. So this is going to be, so welcome to this session today, Robbie, and I look forward to talking to you about what really is a bit of a conundrum for many people, isn't it?
Thanks, Anne. Thanks for having me here today. Yeah, it certainly is. So happy to talk about it today and see if we can provide a bit of information that helps people get an idea about where to start.
So one of the things I think is probably a good place to start is that, if somebody wants to get started with physical activity, coming from such varied starting points, what are some of the best ways they can go about this?
Yeah, I think with physical activity, it often gets lumped into the exercise basket and people might be a little bit fearful of it. And I think if we're not too familiar with exercise or physical activity and we've been out of it for some time, or there's been an injury, then it can be a little bit confronting to get back into, and that can make it difficult. And that can be often be the case. And then if that is combined with a recent diagnosis of diabetes, which is also, I guess, a shock sometimes, or can be quite stressful to be diagnosed with a chronic condition, then it can be a very challenging place to start. And given that there's so much information out there these days on the internet, and maybe not all of it is guiding the person in the right direction, it is confusing. So obviously the best place to start is with qualified health professionals to help out. But probably even before that, it'd be determining what is important to the person in terms of what they think they value in terms of making a change on, identifying that and ensuring that's important to them, and ensuring that they've got some sort of level of confidence to be able to approach that. And that's not always achievable on your own. You may need some support, and that's where qualified health professionals like exercise physiologists would come into play, and even diabetes educators as well can be supportive in that area too. And that way the person can identify one small aspect of physical activity rather than exercise to get started on.
It is a difficult choice, isn't it? But it is really about trying to help people find healthy eating choices and make the changes that are required, and at the same time start to introduce the idea that doing some sort of physical activity doesn't mean spending half an hour in the gym doing hard work. There are so many levels of what is available and what is practical for people to do. And so I guess it's a really nice way to say to you, so when you're talking to someone who's got newly diagnosed type 2, for instance, what are some of the things that you might start to help them choose, how they manage to balance those two things?
Yeah, so we're talking about the balance between physical activity and healthy eating, I guess, because we know that those are two big components, whether it's for pre-diabetes or someone diagnosed with diabetes. The options for management are obviously medication and the lifestyle aspects are physical activity and changes to the way they're eating. Reducing smoking is obviously a big one, or ceasing that as well. In terms of those two that we've mentioned, we're talking about today, there can be confusion about which one to start on. And I guess it's best to ask the person, say, well, do you feel like there's any room in your diet, in maybe not even your diet, in the way that you're eating at the moment, where you could make some changes? And usually they can identify whether there is or not. And they might say, well, yes, look, I notice I'm eating a lot of extra snack foods or junk foods at night, because people tend to have the understanding of healthy eating. Generally, we're all sort of taught it slowly as we grow up. Obviously, through school and adulthood, we understand it, but we might not always, because of barriers in our lifestyle, family, work, or whatever it is, we might not always be able to put it into place. So the first thing for either of those is identifying, well, what can that person change, and what do they feel confident that they can change and work on today or tomorrow or in the first week, because we don't want to be in a position where we're didactically explaining to people that they need to do these 10 things and start them tomorrow, because they've just been diagnosed with a chronic condition. They don't need the burden of all these extra things. So if they can identify one thing, whether it be from physical activity or the healthy eating aspect to start on, then that should be can then be a snowball effect that can be supported by the health professional that they feel comfortable, whether it's a dietitian, diabetes educator, or exercise physiologist. I mean, that's just the starting point, though.
Yes, and it's a lovely way to try and balance it out, because it is very much about that person, and everybody's coming from a different point of view, aren't they? And many people also come to an appointment with either you or I already having made significant change sometimes. I saw a lady the other day who lost 7 kilos before she even got to see me, which was a little while, but she wasn't referred straight away. It was half the trouble, but she'd already lost 7 kilos, which is, and so people becoming very self-motivated and they want to make change. It's about sustainable change, isn't it, Robbie?
It is. And then you're right, there are those people that do that. They might this might be a little bit of a wake-up call and say, okay, I need to change my lifestyle, and maybe they've been wanting to do it, but they just haven't actually got to that action stage of doing it. And just having that information, knowing, well, I'd like to avoid any problems from diabetes or complications, as we might say. So they sometimes we see people, like you said, who will make a lot of changes all at once. And that's not something we'd always suggest, because it doesn't work for everyone. But some people do that, and they've already reduced a lot of added sugars, for example, and they tend to pick the right things as well. They know they reduce the added sugars first of all. They don't cut out all carbohydrates. They're aware that carbohydrates are important fuels, energy sources, and provide fiber and vitamins, but they maybe reduce them, choose better portion sizes and better quality carbohydrates, and they start doing some physical activity. And if they haven't been doing too much previously, then just those two in combination, cutting out the added sugars and an increase in physical activity, is going to result in that change in energy balance, and an energy deficit will result, and they lose the weight. And that's great motivation for them, obviously, to then, when they come to see the health professional, to get some support, encouragement, positive feedback, and then continue on.
So if someone's, pardon me, if someone's trying to work out how much exercise they should do in a day from the start, bearing in mind again that they may not have a good level of fitness. There used to be a slogan, and I don't know, I haven't seen it for a long time, when you're starting out, if you can talk at a pace you can walk, if you can walk at a pace you can talk at, it's a good starting point.
Yeah, look, there's a couple of ways of looking at it. I guess if we're not being too specific about it, we can say, well, the best exercise or physical activity, we tend to say, which we should probably identify what that really is first of all, because we know that for any movement or less sitting is going to be beneficial for someone living with diabetes, or anyone really, because generally we're sitting too much, we're sedentary too much. overall. So any movement is going to require fuel, which means the body will request that glucose or sugar out of the blood and take it to the working muscles. So anytime we're doing that, whether it's gardening, tidying up around the house, going for a walk, or doing a half an hour resistance training class, all of those activities are going to help with increasing the use of glucose, and the overall blood glucose level profile will be better overall. In terms of how much they should be doing, well, it's down to the individual in terms of, well, how much can they fit in at that time, you know? If it's new to them, it's only going to be a small amount, and then it'll be increased gradually at their own pace. If it's something they've been doing, then maybe recently they might want to discuss that with a health professional and get a more structured plan. And in terms of the type of physical activity and what you're getting at with the breath, we know that if we're doing two types really, cardiovascular activity, that's obviously the huffing and puffing, using the heart and lungs, walking, cycling, swimming, all those sorts of things are going to do that. A moderate level of physical activity we know is going to be using glucose that's in the blood, okay, as a fuel. So that's sort of the level we'd be aiming for generally if we were talking about getting up towards that. So that would be, you're able to hold a conversation while you're doing the physical activity, okay, but you're not going to be able to sing, for example, while you're going along. So that that means you're huffing and puffing enough to get the heart rate up. Resistance training, I guess, is the other side of it, and that's obviously a very good activity because the more lean muscle we have on the body, the more cells we have that burn the fuel, which is glucose, or request the fuel. So resistance training doesn't have to be weightlifting. Obviously, it can be using the TheraBands, it can even be cycling, it can be aqua aerobics in the pool, anything where there's push and pull against the resistance. We know using the muscles, strengthening them, is going to increase a little bit of lean muscle mass, even if it's not visible. And those increasing those muscle cells helps us burn more fuel at rest, more fat and more carbohydrate, being glucose, obviously. So the cells of the body become better at using glucose, which is great.
And there's some interesting research that's been done about resistance, isn't there? Professor Dunstan did a lot of work in the early days about how important resistance training was in terms of managing blood glucose and improving blood glucose or glucose insulin sensitivity, basically. It was really interesting work. Sorry, go on.
That's all right. No, you can go.
So I guess if someone, is trying to find that, so if someone's really busy, and we all are, I guess, but if someone's really busy, what would be, if they say, look, I get home from work, I'm really tired, I've had a long day, and it's generally sitting and very little active activity. Is it important then that on the days off they do get it, even if it's 2 days a week, that it is going to make some difference? Some people think, oh, I can't do it anyway, so I won't even try. Whereas anytime, I think it's important to make the point, isn't it, that anything that you can do to improve your physical well-being on top of what
exactly. Yeah, thanks, Sam. Obviously that's a good point for people who are very busy, and most people are working 5 days a week, and trying to fit activity in is difficult. But we did mention before, people who are sitting for long periods of time, it's beneficial even for them just to be moving about. So we can break physical activity up into two types. There's obviously our physical activity that's quite vigorous, and then there's physical activity that's unplanned but maybe just habitual, I guess. So that sort of physical activity we can fit in any time throughout the day, and all these little bits of activity tend to build up and add up throughout the week. The Australian Guide to Physical Activity would suggest we're doing it for 30 minutes every or most days of the week, but that really wouldn't be the first goal for someone who's starting out on their to increase their physical activity. It's just to get started, really. So as we said earlier, identify something that you know that you're going to like to do. It might even in the beginning just, well, I work every day, and I'm sitting a lot at my desk, I'm going to get up out of my desk every hour and just do a quick walk around the office, whether it's 1 or 2 minutes. And that breaks up these long periods of sitting, okay, and then starts to get things moving. Then we can do other habitual things, obviously things like parking the car a little bit further away, and that might increase a 5 or 10 minute walk rather than just the 1 or 2 minutes it was before. So that's our sort of habitual activity that we can add in, and that all adds up over the week. Our planned physical activity, we can start to set small, I guess, duration in the beginning, whether it be, well, I'm just going to do a 10-minute walk on a couple of days of the week. All those periods of activity will add up. And if we were more motivated, maybe even throughout the day. If we can't fit half an hour in one day, it can be 10 minutes in the morning. It might be 10 minutes at lunch and 10 minutes in the evening if we felt we could fit all of that in. And then we're meeting the half an hour of moderate physical activity. The huffing and puffing we talked about before, it's going to burn fuel, increase our cardiovascular fitness, and we'll be getting towards those physical activity guidelines for adults.
Yeah, I've said even things like to people, look, if you can't get to somewhere, but you can have someone come to your home, then go for a walk with them away from your home and walk for 10 minutes away from your home, turn around and walk back. And that's 20 minutes of exercise, you know. So it's at the pace that you can manage, but do it with somebody so that there's company and that they think, oh, 10 minutes. But I said, if you walk 10 minutes away, then you've got to walk 10 minutes home. And that's 20 minutes. But they don't think of it like that. So it's those small chunks of thinking that make it seem accessible, isn't it? It's those little things like that can make a big difference as to how people perceive it.
Exactly. And having someone else to do it with, there's a little bit of accountability that, well, I don't want to let my friend down because they might be looking forward to doing the walk and then maybe having a chat as well and catching up. So you're more likely to participate in it. And anything like that that's going to increase the likelihood that the activity is going to occur is going to be beneficial, because in the beginning, if there isn't much activity happening, establishing a new routine is more important than actually the physical activity, because that will all come down the track. But it's breaking the old habits and establishing a new routine, because then, as we said, it needs to be lifelong. The condition's lifelong, so the activity needs to be lifelong. So there's no point trying to uptake a 4-day-a-week gym regime of 1 hour if you're not going to be able to manage it long term. So it has to be something that the person enjoys. That's the most important thing. And then it has to be achievable throughout the week as well.
And I think it's also important to raise this topic about, well, I don't want to actually do any exercise. I just want to make healthy eating changes, but medication will take over what my, so I'll just go into tablets, and because I can't be fagged, or I can't do it, or it's all too hard. And I think that people, we don't want people to sort of think, oh, well, there are tablets available and I'll just take those, because this is really, yes, they may need to take oral medication down the track and insulin down the track and other medications that we know are available for people with diabetes, but nothing really replaces the overall well-being. And it's not just about the physical wellness. There are also mental health benefits, aren't there, Robbie?
Exactly. And I think just the diagnosis of diabetes can decrease someone's mood. And if they are doing more physical activity and feeling better about themselves, then that's going to increase that level of mood that they're going to have just generally over the period of a week, for example, or directly after they're doing the physical activity. One, from actually the participation in the physical sensation they get from the activity, and also maybe the socialization that happens with the people they're doing it with. And then obviously in terms of diet, yes, there may be some people might be thinking about, well, it's easier for me to take tablets. Often though, I see that people do want to make changes with their diet, but they may not have the most appropriate information, and they might pick an easier option to reduce the energy intake in their diet. And often what we see is people are cutting out either whole food groups, say reducing carbohydrates down to a very low amount, or cutting out all dairy, for example. And these are one or two of the core food groups out of the 5 food groups for Australians. So if we're doing that, those people are putting themselves at risk of, nutrient deficiencies, lethargy, obviously having enough energy in general. And they're not really setting themselves up, as we said before, for a sustainable approach to healthy eating and lifestyle change. And that it's not necessarily always their fault. It's just that the information might not have been provided, or they might not be aware where to look first, I guess.
Did you want to talk a little bit about the rate of weight loss and what is an ideal weight loss? A lot of people think, like I was surprised when this lady came, she'd already lost 7 kilos, but that was over 3 months because she wasn't referred straight away, which was disappointing. But the importance of gradual weight loss it is really important about the sustainability of everything around their well-being, isn't it? You don't want rapid weight loss because in itself that's got problems associated with it.
No, we don't. We don't. And I think there's dangers there, obviously, in terms of we're going to be burning the wrong fuels. And obviously we get our energy from carbohydrates or fat or protein. Alcohol is also an energy source, but it's not obviously the one that we want to be getting our energy from. In terms of burning those fuels, we've got a certain amount of stored carbohydrate as glycogen in our liver and muscles and other places, and then obviously we've got stores of body fat, regardless of whether that's putting the person within the healthy weight range or above or below. But if someone was to look to burn to lose weight, then if we're doing it in that slower approach, which is sort of half a kilo to a kilogram a week would be optimal, then it's likely that the fuels that are being burnt are more likely to be stored body fat, rather than a rapid weight loss that can often be a lot of stored body fat, yes, but also lean muscle mass. And if we're losing a lot of lean muscle mass, then there can be issues with stability around joints, just general muscle tone. And the main thing we said before is that the more lean muscle we have on the body, the better that the body is at maintaining our blood glucose levels, because the glucose can get out of the blood and into the cells of the body. So we really want to hold on to that lean body mass and even strengthen it and prop it up a little bit with some resistance training and just slowly decrease the weight, which is really just tipping the scales into an energy deficit slightly. And that's either going to be increasing physical activity or decreasing the amount of energy coming in, or both, hopefully. So yes. We need to just pick a little bit from either side to create that energy deficit, so there's a slow burn of weight, and easy to be said, I guess, but with all the barriers that can be there for people in their lives, it can be quite challenging.
And I don't want to dwell on this too much more, but I wondered, we know a lot of people will come to you or me maybe and say, they mightn't come to you and say it, but they would come to me and say it, I lost a lot of weight quickly, and as soon as I started to introduce carbohydrate again, because they went carb-free, that they put the weight back on and they were heavier than they were before. And a lot of people don't actually understand what's happened to their body in that situation. And so that just is really about making the comment about the fact that what we've said and what you've basically said today is that the slower the better, because your body will use the right part of energy that it needs to lose and not the wrong part.
Exactly. So I think the danger with that is that, well, look, we know carbohydrates generally somewhere between 45 to 65% of our overall energy consumption should be coming from carbohydrates. So if someone to severely restrict that, they're cutting out nearly 50% of their overall energy intake. So yes, they're definitely going to lose weight, but obviously when that is replaced again or introduced even at a lower level, all of that amount of energy or kilojoules will be returning. And if it isn't an overall approach with a reduction of, say, lower fats, for example, then that those kilojoules would just return, and the energy deficit has gone. In fact, it might have even gone the other way, like you said, and weight might increase.
Exactly. So I I think we've talked about a fair bit. There's a couple of things that we haven't talked about. Some people have made the comment about, I go to the gym 3 days a week. Is that enough? Well, it possibly is around, depending on what else they're doing, I guess. And I suppose it depends on how their lifestyle manages to, if their lifestyle allows that to occur in a sustainable way.
Yeah, and that sort of comes back to our habitual activity as well. So these days, the recommendations aren't just around, 45 to an hour of physical activity 3 times a week and then be completely inactive on those other days. So we tend to try and encourage, and the evidence suggests that we should be encouraging physical activity on most days, even if it's in lesser duration of that. And also a bigger part of it is decreasing those long periods of sedentary activity. Okay, so rather than having inactive weekends, maybe those activities that are planned on the weekend don't revolve around sedentary activity, and they revolve more around movement, whether that be gardening, activities that are in the outdoors, parks, going for a cycle and then having morning tea rather than just going straight for morning tea and sitting for a couple of hours. So that promotes, I guess, this a constant movement, and is obviously again great for the body's use of fuels, especially glucose.
I think it's a good opportunity for us to also say to everyone listening today is that, and watching this today, is, if you get diagnosed with diabetes, or if you get diagnosed with impaired glucose tolerance, which can also be called pre-diabetes, it's really important not to be frightened about what you're doing, that seeking professional help from a dietitian who's not going to give you a lettuce leaf and a carrot stick to eat for the rest of your life. They're actually going to want you to eat a cross-section of healthy foods, and there are a great lot of choices. And people often have a lot of myths about, I'm scared about what they're going to say, because I've known people, and I bet you have too, who've come out of the dietitian's office and walked into mine and said and disclosed different levels of information, which is fascinating, literally out of one office into another in the same hallway. But I think it's really important to promote the importance of seeking professional guidance from a dietitian. It's a therapeutic intervention, and it really is important to get as much information as you can, because people say, I didn't realize I could eat this. And because there's a lot of myth out there, isn't there, about what healthy eating actually looks like.
Yeah, definitely. Look, one of the most common things that I would hear is, or I'm asked, is I just want to know what I can eat and what I can't eat. That's a big one. And also, I've been told I can't have any carbohydrates, or I can't have any more bread, etc. So they're probably the 2 most common ones around confusion and myths. And as we know, we say glucose is the preferred energy source for the body. It will use glucose. The body will use glucose first, and glucose comes from carbohydrate, which is obviously our bread, cereals, rice, grains, starchy root vegetables and fruit and things like that, and even in some dairy as well. So there's carbohydrates across every group of the 5 food groups. So cutting them out is obviously not the option. Choosing more quality carbohydrates that break down slower is important. And that sort of comes across that low GI or glycemic index approach that people may have heard before. And getting all of this information and across to you in an individualized way is important. And you'll get that through an accredited practicing dietitian, rather than just maybe searching the internet or taking advice of family and friends who might have your best interests at heart, but may not have diabetes or the actual understanding of what it is, because it isn't cutting out all sugar, because glucose is a sugar. Yes, we want to reduce added sugars, and they come from the discretionary or sometimes foods. They're in large amounts in small volumes, but we need a certain amount of carbohydrate. So it's important that the information is evidence-based and we avoid that misinformation and sometimes rogue practitioners that we obviously try to get everyone working in a best practice approach.
Yeah. And because of so many, as I said earlier, and you've already said today, that there are so many people who believe certain things, and it's important they get accurate and reliable information from sources. And I was going to raise stuff about the internet because there will be a plethora of stuff out there. There are lots of stuff out there, some of which is American. And you do need to make sure that the information that you're relying on comes from, well, Australian practitioners who are relying on best practice and who know the sources of the information they're giving you a bit to be reliable. And it's really important because there's a lot of American stuff there that's just not, it's just not us anyway.
Yeah, it has to be obviously individualised to obviously our environment over here, and in terms of where we're shopping, and then the units that are used, whether it be kilojoules, versus what's used overseas, calories. I mean, there's no reason why you can't use calories if you don't want to, but kilojoules are on the packaging here. And then there's obviously confusion around label reading as well, but that's a whole nother topic of conversation, really.
We might have to tee you up for one on label reading, I think, because
that could be a good one.
It's a huge issue, isn't it, really?
It is, yeah, where to start. But again, there is information available out there. The Dietitians Australia website have got a good A to Z list of information as well. So that's worthwhile looking at that if people wanted to get started and organise a consult with a dietitian.
Yeah, that's very good advice. What other things would you like to talk about in this conundrum topic?
Look, I think that the crux of all of this, physical activity versus healthy eating rather than diet, is that they sort of need to coexist. Someone who might have a lot of barriers, I guess, in the beginning when they're recently diagnosed, it's not necessary for them to make changes from either one straight away, or both, straight away. But if at least one change can be made and they identify which area it is, well, I feel like I can work on physical activity, and they get started on that. And then they have support from a health professional, and then changes in their way of eating can be introduced as well. But essentially, both of them do need to coexist if we're looking at the management of diabetes and the prevention of problems, because that's the whole reason for doing this, is keeping blood glucose at a level that prevent the risk or decrease the risk of complications or problems from diabetes. And we know that physical activity, for example, has a big impact on it, almost as much as tablets such as metformin, in terms of a reduction of HbA1c over a 3-month period. So they can have the same amount. Diet or healthy eating as well. If someone was over consuming a lot of added sugars, then just by reducing those and cutting them out, there will be a huge difference in the blood glucose level management and risk of complications immediately and in a very short period of time as well. So it can be quite a rapid change if there are big areas that can be changed. For someone that maybe is already eating fairly well and maybe their diagnosis might be more due to non-modifiable risk factors such as age, gender, or ethnicity, then it might be just increasing more physical activity and just making a few small changes from the diet. But without having some assistance, I guess, and support around making small manageable changes that can be stacked on top of each other over time rather than all started at once, it'll be difficult for someone to achieve.
Yeah, I think you've summed it up really quite nicely. I'm just looking through some of the things that we thought we'd talk about, and I think we've nearly covered all of the things that we said we might touch base on. I can't, everything we've talked about is certainly current in my head. I think that might be it. Is there anything else? I think that might be the end. So thanks very much, Robbie. It's now time for questions. So if anybody would like to ask questions, this is a really interesting topic, and it is something that confronts everyone who has been diagnosed with diabetes, either impaired glucose tolerance or diabetes. So please feel free to join us for questions, and Robbie's available to answer those now.
Thanks, Anne.
Thanks, Robbie.
Okay, so I hope everybody enjoyed that. It was a great session, I thought, and so many questions there that many people can relate to. we have one question. Well, we've got a few questions actually to start with. Could Robbie please give an overview of the use of a rehab approach to getting moving again after having not been actively moving for some time?
That's a good question, thanks. Well, I mean, that sort of ties into what we were talking about, in that we're trying to make small changes, and any small changes are going to add up. So if someone was injured and that they are obviously going through a rehabilitation program, the exercises and what they're going to be doing is different to someone who is at their, I guess, their normal baseline activity level. But any movement, as we said, any movement that someone does is going to require energy, and glucose is the main fuel source for the body. The body will prefer to use glucose, so it will help. Any of that rehabilitation activity you're doing is still movement, and it will help with blood glucose management. Maybe not as much if the intensity is quite low as a moderate intensity 1 hour walk. However, that's not really the issue, the point, should I say, because we just want we want people to be getting in a routine that is going to set themselves up for success in terms of completing or increasing their physical activity over time. So it becomes automatic and it's a part of their life, and then it adds to the healthy lifestyle approach. So a great way to get started, I mean, it's the only way to get started after an injury is doing rehab, and yes, it will be beneficial for diabetes management in the long term. So
there's a question that says, if my diabetes is well controlled, can I have honey?
Yeah, of course. We know that people living with diabetes can have a small amount of added sugar, and it's not going to have any long-term detriment to blood glucose levels. I mean, once the honey, the sugar from the honey is in the blood, the body doesn't know the difference between that and table sugar. But at the end of the day, if you're adding honey onto, a teaspoon of honey onto a high fiber cereal like muesli, rolled oats, or something like that, and if that helps the palatability of it, and then you're consuming this good high fiber breakfast with, maybe reduced fat milk, then that's not a problem at all. Obviously, if it was, a tablespoon of honey in our cup of tea every day, and we're having 8 cups of tea, then that might add up to something that's unnecessary. But I think adding it to help to consume a good quality, high fiber, lower GI food, then there's no problem. Yeah.
Another question here says, I have lost weight a few times, but it comes back. What can I do?
Well, I mean, that's the tricky thing, isn't it? It probably then, at a guess, without knowing much more than that, whatever that was put in practice wasn't sustainable, and it might have been a bit too full on. So it's really got to be cut down to the bare minimum basics. What can you actually achieve, and that that you'll still be able to achieve it in 5 years' time? It can't be something I can do for 3 months and then it all gets too much, because it's strict and interferes with our own activities of daily living and all the other things we've got going on in our life. So it has to fit in, and that's why starting off at a much smaller amount than the recommended physical activity guidelines is the way to go, especially if you're just getting started again.
Absolutely. Another question here says, what's your advice for people with pre-diabetes? Which way to focus more?
So pre-diabetes and diabetes, whether you have diabetes or whether you don't have pre-diabetes, but you want to prevent either of them, the management is the same, or the prevention is the same, or the prevention of the progression of diabetes. All of those, it's the same approach that we've been talking about, which is lifestyle interventions. It may just be without medication, that's all, I guess. So we're looking at physical activity in combination with a good approach to healthy eating. So it's actually the same. We would be talking almost identically, except maybe in the case for people living with type 1, for example, and it's a completely different kettle of fish. So they've got to do a lot more carbohydrate counting. But in terms of prevention of something, type 1 isn't preventable, but type 2 is to some degree, and definitely the progression onto it is. So we know that it's a combination of what we've just talked about in that webinar of healthy eating and physical activity.
Yeah. There's another question here says, I have type 2 diabetes. Should I not have any carbohydrates at all? We did address this a little bit, didn't we?
Yeah, I think we did cover that. I mean, in one sentence, glucose is the main fuel source for the body. It's the preferred fuel source. It's the most in proportion to carbohydrate, into fat and protein. Sorry, it's the fuel we use in the highest proportion out of those three. The brain and red blood cells can only use glucose, and then glucose comes from carbohydrate. So apart from times of starvation, that is. But no, we don't want to cut them all out. The results will be lethargy, micronutrient deficiencies, lack of fiber, all these sorts of things. So it's about having quality carbohydrates, which is a low GI sort of approach or glycemic index, and spreading them out across the day in appropriate portion.
There's a question online from a newly graduated dietitian, Robbie. I don't know whether we haven't got a name, so I can't give you the name, but she says she's a newly graduated dietitian and was wondering if you recommend a course or perhaps another resource to further increase her knowledge. Their knowledge. I don't know how we can respond to her more one-to-one.
I can send. There are courses that I know of which cost a small fee, $20 to $40. And I can type the answer in directly to her about that. He or she, depending who it is.
I haven't got a name, so I can't know. I don't know whether No Diabetes actually know who that is, but it would be worth us at least providing some resources, and maybe they can pass that on.
Yeah, I can send that to the
Thanks, Robbie.
now.
Yeah, thanks. Are there any other questions that people would like to ask? There's some great questions there already. That's really good. Somebody says, I know we've already answered that question. I'm catching up with them all. I think we might have taken all the current questions that are coming our way. Is there anything else that we thought we should talk about that we've realised and we might have wanted to mention a bit more about? We've covered an awful lot in depth and detail in this session today. And we've had some great questions about it. Is there anything you thought of? Oh, I must mention that at the end of the session. Do you want to reinforce or just to comment on?
I mean, we didn't talk a lot about actual weight loss, but that's because I don't really think that is the best approach immediately. It's more about, and that's what I've talked about over and over, I guess, is just establishing a routine for healthy lifestyle change. And then essentially, well, as part of that, weight loss, if it's actually required, it'll just naturally occur. So, and that can then be built on. But we know just going straight out for weight loss generally isn't the best approach. I mean, in certain cases it might be, depending on other comorbidities and things like that, and discuss that with your health professional, whether it be general practitioner, diabetes educator, dietitian, etc., exercise physiologist. But we're making generalizations here because we have to. It's not, a one-on-one consultation, but generally that's the best approach, unless there's something else that clinically you need to be addressed, I guess.
I mean, we have reinforced a lot today about the importance of, like you said, sustainable change, small steps, and really not putting yourself under so much pressure to change the world in 5 minutes, because it just makes it too hard, and the sense of failure then becomes a real thing. And it's terribly important that people don't get that sense of failure, and so small steps helps to make sure that you achieve those goals along the way.
That's right.
Any other questions out there, folks? I don't think we have any. None are coming through to my phone and none are coming online. So I think it's been a fantastic session today, and I can tell by the amount of interest that online that we've had lots of interest in the social media side of the session, and I hope that everybody who's joined the session today has found it informative. And thanks to everybody for participating. Robbie, thank you so much for an excellent session. Oh, hang on, we've got another question. Oh, thanks for the valuable session. Yeah, it really has been a great session. And thanks again, Robbie, for your time today. It's been excellent. And I'm sure we'll see Robbie again online in another No Diabetes Seeds session.
Yeah, thanks, Anne. Great to be a part of it. And best of luck to everybody out there, and tune in for more, I guess, in future.
Yeah, absolutely. There'll be more down the track, folks. So stay tuned and watch this space for another seed session. Take care, everyone. And thanks again, Robbie.
Okay, thanks, Anne. Bye.
Bye, everyone.